Well, hello and welcome to Oracle TV. I am here today with Dr. Ilana Halperin, CMIO of Sunnybrook Health Sciences Centre, and Rob Lee, Vice President of Digital Health and CIO of Sunnybrook Health Sciences Centre. Thank you so much for being here and talking with us. I'm so excited about this conversation and get your perspective and how you're shaping the future of healthcare. So let's just jump right in, actually, and I'd love for you to share a little bit about your work and mission with us.
Okay, so as the CMIO at Sunnybrook, we're really excited to be partnering with Oracle on the Project Reach, which we will get into in a little bit.
Yep.
But I can just share that Sunnybrook is a big academic health science center in Toronto, Canada. We have close to 1,500 beds and over 1 million patient visits a year. Heavily involved in research and innovation, fully affiliated with the University of Toronto. So really excited to take this next step in our partnership with you.
Well, thank you so much for sharing a little bit about that work. So what are some of the challenges that you face in delivering care?
Maybe I'll start. I think some of the challenges we faced, especially on the technology front, is we're a best-of-breed organization. And so we have numerous systems across the hospital, all trying to speak to each other. We have a homegrown EMR as well, which I think we've done an amazing job sort of creating for our physicians. But we also know that, our systems are supposed to be interdisciplinary. And so it's more than just what the physicians need. It's also what our nurses and other health professionals require too. So that's been a challenge for us for sure. We're also heavily paper-based. And so, for example, things like nursing documentation is still all on paper. So we have a lot of the traditional challenges of things like where's the chart and who's taken the chart and who lost the chart. And so certainly even just some of those very practical logistics have made it a challenge. I think we deliver absolutely incredible care at Sunnybrook. And, we are definitely a top-ranked hospital, despite the fact that we don't have a commercial off-the-shelf electronic health record. And so for us, this is an incredible opportunity to kick things up a notch in terms of having the right tools, the right digital health tools, for our providers to be able to deliver even more excellent care.
And speaking of those digital health tools, this year you were able to pick Oracle Health as your EHR partner. And so, in launch, what you just referenced, Project Reach, did I get that right? Okay, so tell me a little bit more about that.
Sure. So what Project Reach is what we've branded our, enterprise-wide transformation from a best-of-breed shop to a off-the-shelf commercial HIS. Reach stands for Renew, Expand, and Advance Clinical Health Informatics, and we're reaching for the stars. And that's really why we chose that acronym to sort of brand the entire experience, which has been already 2.5 years in the making with the full-scale request for proposal and the various bids. And we're excited that we're finally ready to kick off implementation.
I love that, the reaching for the stars. And I think kind of going off that, it kind of leads to my next question of what inspired this journey beyond the stars? What inspired this moment?
Yeah, Rob certainly spoke about it. I think that Sunnybrook is known for innovation, and we really were trying to innovate in the digital space. But the last 5+ years have really shown us that hospitals shouldn't be in the business of making their own software. And in some cases, we built our own. In other cases, we brought in individual tools to meet the needs of certain clinical users. But it created a fragmented experience for our clinicians and, more importantly, for our patients. So as much as we're able to deliver very high quality care, patients would comment that they felt like they were repeating their story. They'd sometimes come to my office. I'm an endocrinologist, and then I wouldn't know that since the last time I saw them, they'd been to the cancer center and diagnosed with a new life-changing diagnosis. And I would feel horrific that I was busy talking about diabetes when I should have been asking them how they were coping with their cancer. And so we really need to move to a single record for the whole patient and ideally increase our interoperability across the province of Ontario. And we can't do that until we are on a system like Oracle Health.
Yeah, maybe I'll just add as well. I think there was a period of time where it wasn't really clear that hospitals and other organizations would move to commercial off-the-shelf offerings. So I think at one point, Sunnybrook was extremely innovative in terms of what we were doing with our own homegrown EMR. But to Ilana's point, I think it's become very clear over the last few years that, we moved from a period of innovation to one of more isolation. And so really being part of the Oracle Health family is going to move us forward in terms of being able to work with our community partners and community and partner hospitals. So we're very excited for that as well. It's a huge enabler.
I'm excited for you, and thank you for going on this journey. And I think, at the heart or at the core of Project Reach is that care redesign. So how do you think this is going to impact the patient and the families? Do you think they're going to see this right away?
Yeah, just in terms of, I'll maybe start with the patients.
Yeah.
Sunnybrook's been really well known for the work that we've done around patient portals. But we really see the work that we're going to do with Oracle Health with the next generation patient portal as a way to really kick up the notch in terms of how we're going to engage with our patients. So again, better access to information for our patients, better access to things like virtual care, the ability to communicate with their providers online. It's a huge step forward for our patients. And Ilana, I think, also touched on a really important point as well, like having a one-stop shop for information really prevents the patients from having to tell their story over and over again. So in a best-of-breed environment, we're constantly double documenting, triple documenting, quadruple documenting things and asking the patient the same thing over and over again. And left hand and right hand don't always know what they're doing. And so for us, that's a huge enabler from a patient perspective. Dr. Halperin, certainly better to speak from a provider perspective, being a provider.
Yeah, and what I think is interesting is that I was worried that there would be more resistance to the idea of moving from best of breed to an enterprise system because I thought the clinicians have all worked hard to create systems that meet their needs. But most of my physician colleagues are really excited to take this step and move to a single system. I think for two reasons. The first is what we've already discussed, which is currently data is fragmented and siloed even within our organization, and we need to fix that and have a single record. And the other is the exciting moves in terms of AI and what the next generation EHR looks like. The providers will be able to do their care more seamlessly, less clicks, less drop-down menus, and everything available in a single place. Portability with mobile workflows, which will enable them to give more time to the patients, more face time with patients, less time at a computer screen. And that's what everybody is looking forward to with this, future of healthcare.
So this is impacting the patients and it will the clinicians as well. I mean, again, this is a great journey you're going on. And I think there's one thing that unites us all, every single person, is that at one point we will all be patients. So for you to be able to step outside that and see that this is best for that patient is great. So they don't have to keep repeating themselves and going forward. But it is going to be an exciting future beyond what you all are just doing, but with how you mentioned AI in the mix. So with that, what are some of the biggest opportunities you see for Sunnybrook in the future?
I think Rob mentioned the patient portal.
Yes.
I think we're very excited about the possibility of improving the patient experience and also the clinician and front office staff experience when we're using the patient portal, as opposed to phone calls and voicemails and emails that are not all, landing in the same place with the chart. And enterprise scheduling, I think, is really, really important for our organization.
Yes.
And then I think even some of the demos that I saw this morning that were really exciting around the patient portal, having that sort of AI companion, I think are very exciting. And I think we're also going to talk about research, Rob.
I think the ability to have this information in one place is really going to help research. So we have a large research institute at Sunnybrook that we love to support with data, but trying to support them with data that comes across so many different systems is very difficult. So having, again, a one-stop shop to access patient data, especially given that we have well over 1 million encounters a year, is highly valuable from a research perspective. So we're really excited about what this will offer. Clinical trials is another piece that we're very excited about. So clinical trials management, the ability to identify clinical trial candidates and to be able to do even the administrative component of clinical trial management all in one system is a fantastic opportunity for our research institute. So it's great for our patients, great for our providers, great for our scientists. I'm super excited about it.
Well, I'm excited for both of you, and I'm excited for Sunnybrook. Thank you so much for the work that you are doing. You are empowering the physician. You are also empowering the patient. So thank you. And thanks to all of you for joining us on Oracle TV.